Hi everyone, and thank you so much for inviting me to present my thoughts on unpaid care work in South Asia. I'm really sorry I can't be there with you in person, and I'm sending you a recorded message. But I'd be very happy to hear feedback, thoughts, comments. You can definitely email me and get in touch through that. So I'm going to talk to you today about unpaid care work more generally, but also then specifically thinking about the issues and opportunities that we have in South Asia for this. I don't need to say much about unpaid care work and what it is, but I will still lay out the structure of what it is and why specifically is it relevant for women and girls in South Asia. I'm going to talk a little bit about the policies that have emerged after the impact of COVID on women's care responsibilities, and then finally finish with some policy asks and strategies about how we can actually make a care integral economy work. So first of all, to start off with, we all know that care is really important. It is the bedrock of human society, and it can really be understood as meeting the material, developmental, emotional, and spiritual needs of other people. And it's really specifically important because this is done through direct personal relationships. As you can see, care here is a direct care where, it's care of people, looking after the children, the sick, the elderly, but also a lot of unpaid care work, or in fact, care work happens behind the scenes, which is kind of things like cooking and cleaning and washing and collecting firewood. And of course, all of this is exemplified in the picture in the middle where it literally is, like a direct and indirect care coming together. So what I think we should really remember is the fundamental premise of care being a good thing. It sustains market economies. It has a widespread long-term impact on well-being and development, and therefore we think that it is critical to address inequality and vulnerability. Now, this is something that I will draw on more in the later slides, also in terms of who does what in the household. This is a study that we did in 4 countries, in two in South Asia, India and Nepal, and two in Sub-Saharan Africa. And here we see here how, in nuclear families, most of the household work as well as the water and fuel collection is done by women themselves. Interestingly, childcare and care of animals is more shared, but equally, if you kind of think about it, the responsibilities of what happens in these tasks is also very much determined by how the household is structured. So I thought I'll show you this, that to kind of say how overwhelmingly female the unpaid care and domestic work is, and to kind of think about why this unpaid care and domestic work is done mostly by women. Some of the literature talks about how care has been seen as a natural feminine activity. It is what women do, and there are also very deeply embedded societal assumptions about what is to be male and what is to be female, and there's a stickiness of gender roles, as you will all understand from your respective contexts, that is really really crucial to understanding how households divide care responsibilities. Now, but also it's kind of like, like why women do the way they do. It's kind of like, oh, some people will say this is what I saw my mother do. And especially in South Asia, there's a lot of what should I say, learning that happens across generations. So women, teach inherently by their behavior what daughters are meant to do and what sons are meant to do. And so comes from the fathers. So it really is very kind of like generational, and so therefore very, very sticky to change. I thought I'd also show you this from the same 4 countries data. And if you see here, that it's interesting that the gray is the biggest, if you think about the unpaid care work, and that is actually household tasks, whereas direct care is very little, which is the orange bars. It's kind of like only about like an hour or so directly. But we collected this from women's time diaries, and so this is self-reporting. So what happens really is that there's a lot of not just direct care, but also supervisory care. So when women are doing paid work, so in India, for example, they were only spending about 2 hours in direct childcare. But when you think about, when we ask them about, oh, but what do you look after children while you do other things? It went right up to more than 4 hours, and so so similarly, so you can see that women actually underreport childcare because for them that is basically the time that they spend directly with the children, whereas actually there's a lot of supervisory childcare as well. And there are papers in the conference, I've seen the agenda, that talk to care responsibilities, especially about childcare. So I hope you have a good discussion about this aspect of direct versus supervisory as well. Coming back to this, like again, we've talked about childcare being a part of other things that they do. And we saw how women, even in the pandemic, we saw how women are balancing childcare with paid work and really, as this quote says, performing miracles. So, there's this lady we interviewed who is a mother of two, living in an urban settlement. And it almost, she says, well, that she goes for paid work, but that, this paid work finishes later than her childcare finishes. And therefore, that 1 hour in the middle, in terms of flexibility of leaving jobs early, etc., if it's not there, then how does one manage that gap between childcare provision and working hours? So a lot of multitasking, a lot of performing miracles happens in households, and the impact of this unequal distribution on women and girls' shoulders means that there is a large amount of time that goes into this unpaid care and domestic work, which then in turn restricts women's participation in civil, economic, and social spheres. But it's not just the lack of participation that worries us as feminists, but also in terms of the reduction in women and girls' well-being, because they don't have time to rest. There is no time to rest. There's lack of leisure time. And we saw that in India and Nepal, especially when it's rural settings or remote urban settings, there's a lot of drudgery involved in unpaid care work tasks. Things like cleaning the household or washing becomes a major task because there's no water supply, and then you have to go and collect water, and that itself takes time, but also takes a lot of energy to carry buckets of water on one's head or shoulders and bring them back. And that we saw had very adverse health outcomes. Ranging from kind of like allergies and eye problems because of the smoke that women were having to put up with, but also in terms of, let's say, more serious health outcomes such as uterine prolapse and things like that when women are carrying heavy loads and are pregnant. So in Nepal we saw that. So it's kind of really important to understand that, but it's also really important to understand that there is a bidirectional relationship between unpaid care work and paid work, which basically means that it's not just that unpaid care work restricts women's participation in paid work, but there's also other linkages, which I will go through in a minute later in the presentation. But overall then, if care responsibilities affect women's chances of competing on a level playing field, then one really needs to pay attention to this. And this is quite an old movie, but it's a really important one in terms of thinking about the chain of unpaid care and paid work, right? Women who can afford to do so, and this is rife in South Asia, hire poorer women to do their care work. So then the unpaid care work that is not done by the woman who is doing other things, including paid work, becomes paid care work. But then these women are really often underpaid, overworked, and subject to racial, caste, and class-based discrimination. And a lot of that is mainly due to the undervaluing of care that happens. And this, we did another study in the ASEAN countries, and we found that the disproportionate impact of unpaid care work had incredibly important gendered aspects and effects. So it was not just that women had reduced labor force participation, but also that they could not even access the care infrastructure, the health, the education that is that is meant for them. There was no time, there was no energy left. We saw that COVID intensified crisis, so I'll talk about that in a minute a bit more. But we also saw a lot of mental and physical depletion for women and their families, and also that the fact that intersectional aspects such as race, class, ethnicity, and disability really exacerbate the negative effects of this disproportionate distribution of unpaid care and domestic work. I told you that I'll talk about both of these interactions, and this is coming really from the project, the 4-country project that I call GROW, which has information from India and Nepal, as well as from Tanzania and Rwanda. And here we found that unpaid care work affected not only whether women entered the labor force, but also that how they chose to take lower quality, lower paid jobs closer to their homes to manage their unpaid care work. This led to a concentration of women in certain sectors, but also we saw that if there was a chain of care work and paid care work, that the income from paid work was eroded very quickly with costs of childcare or costs of like the cleaners and cooks, etc. And women are discriminated against with whichever class you talk about because of their unpaid care work responsibilities. They were told that, like you can't work, or you're not sincere, or you're not being able to spend enough time, etc. And I've talked about the drudgery of care work, which impacts the health and productivity of women to undertake paid work. We also saw a lot of lower bargaining power and tiredness. So because the woman is literally hanging on to mostly, as I said, informal, lower quality, lower paid jobs, then there was very low bargaining power in terms of asking for more money, whether it's for small enterprises or it's for paid care work. But then paid work also affected unpaid care work because, for example, in India and Nepal, women's paid work did not result in reorganization of care at home and in communities. It only resulted in women's own time, and our teams talked about how it was like a time stretching. So women would get up earlier, sleep later, but also there was less uninterrupted sleep. So while there was a lot, like some, you could say sleep, but the mum sleep, which is basically was interrupted not only because of childcare, but also because the water's coming at 4 a.m. in the morning, or the sick relative has to be taken care of, etc. And the drudgery of paid work, especially in informal low paid sectors, cannot be understated. It compromises women's health, compromises women's time, and we found that women were actually taking on more and more paid work because the income from one particular job or opportunity of engagement was so low that they had to do more tasks in order to make up what they needed, which basically meant that there was a lot of time taken in paid work. And this, and who cares when women work in paid work was really young girls, older women. But also we saw a lot of reduction in care, adverse outcomes for care recipients, children being tied and left alone in homes, older people left alone with just a glass of water, etc. So it was really difficult in terms of both the quality and the quantity of care that really reduced when women were doing this kind of paid work. And this effect of this double burden of having paid work as well as unpaid work, unpaid care work, is really on women's well-being. So as I talked to you about time stretching and time poverty, which is like the lack of adequate time to do things, but there was also stretching of physical and mental capacities. I talked about depletion earlier as well, where COVID really exacerbated the depletion. But in this particular study, we also found the contours of this depletion included both emotional fatigue, the guilt in which they were kind of like leaving their kids or like asking children to, or usually the eldest girl to help with childcare or with cleaning or cooking, and the lack of rest and leisure really affected them physically as well. And we also found that there was a seasonal effect in the intensity of women's double burdens. So during harvest season, during things like festival season, like it is going on right now in South Asia, there was a lot of more relatives coming, etc. And so a lot more time poverty reported by women due to these various outcomes, and therefore a reduction in their overall well-being. In India and Nepal, I told you about like this whole idea of like uninterrupted sleep was really much lower than the sleep in total. We found that women were multitasking. Over 14 hours a day was spent when they were doing more than one task. But only about an hour or less than 2 hours where they would think about personal care, which included bathing and getting ready, hygiene, and any leisure time. So you can imagine the time pressure that is there on women. And in another study that we did, this is information from Bangladesh and Pakistan, where we found that women were also multitasking a lot, and there were specific peaks, and you can see that the peaks are roughly coinciding to either kind of like, children getting up or elderly relatives getting up. 4 to 5 a.m. is a very important time. Then when children return back from school, or lunchtime is very important. And then like 9 to 10 p.m., which is again, bedtime, dinner time, etc. So there was a lot of intensity of multitasking at specific times. And this double burden really did not just affect women, but also children. As I said, children were left alone. Women had to carry children to work sites, which was not safe at all. And we found that there were school dropouts, that women had to often pull out their older girls as young as 7 years or 8 years old in order to take care of the younger sibling, but brought to the work site, etc. So it was really important to note that women's double burden affects not only their own well-being but also children's well-being, and this is all tied together. And as I said, COVID really exacerbated this depletion, this impact on unpaid care work, where it was found that women were spending 11 times more in some countries time on unpaid care work than men did. So that is a massive amount, and so we need to put that into context when we think about what we can do and what was done in COVID. And we talked about care sensitive and gender differentiated policy measures. And just to kind of explain to you, care sensitive policy measures are those that really take into account care responsibilities, whoever's doing them. But gender differentiated policy measures go a step further, where they not only talk about care sensitivity, but also specifically focus on women and their needs. So we found that unfortunately in 59 countries of the Asia and Pacific, where South Asia forms a very important part and a very big part, that there were only only very little amount of policy measures, as you can imagine. So overall, there were only 12% measures that were care sensitive and gender differentiated. And of these, most of them were about social protection, cash transfers, and very little to do with building infrastructure, let's say, or care services. And so that was really, really important, that we needed to kind of differentiate between the fact that measures could be care sensitive, but they still could not take into account women's differential needs. And this was a very sobering finding. And you can see here that in terms of the sub-regional measures as well, South and Southwest Asia, again, is really about, out of a total of 158 measures, only 38 were actually care sensitive, and of those, only 13 were actually specifically focusing on women's differential needs. So it is a very sobering picture and has a long way to go. And we also found that budgets were really careless. So, spending more on defense and infrastructure, like those kinds of sectors rather than education, health, and, and agriculture, where women are really concentrated. So their services that the women receive were really about, not commensurate with the amount of care and domestic work that they were doing, and therefore their needs. But this really gives us pause to think, but also pause to, I suppose, think about different opportunities that South Asian governments can have in building back better, where we need to think about recognizing care as foundational to economic, political, and social life, and thinking about moving from a double burden to, let's say, a double boon, where income and economic support takes into account the fact that women are doing disproportionately high amounts of care and domestic work. But how does one actually ensure care sensitive and gender responsive national programming and policy? Well, we've had lots of examples in the past. In the UK, there was a campaign in which went wages for housework, which was not just imputing a monetary value, which is kind of also there in terms of thinking about time use diaries, but really thinking about putting housework on the agenda of policymakers, and often actually imputing just a monetary value to care, some time, measurements in terms of how much care women are doing, etc., can actually lead to an undue focus on the fact that only that is valued is actually, only that is monetized is valued. And so, in order to get away from this, there are other aspects that has been done. There's been a linking of care to human rights and to women's rights, and thinking about the fact that that everybody has the right to care without being exploited, and also the right to receive quality care. And the UN Special Rapporteur on Extreme Poverty and Human Rights, Magdalena Sepulveda, talked about how care was treated as an infinite, cost-free resource that actually fills the gaps when public services are not available or accessible. And we've seen that in countries where public services are being rolled back, women are stepping in because they have to, so care has to be provided. And this actually then violates their human rights, and really lets the state off, where the state should really be responsible as part of its fundamental human rights obligations in order to provide care services. There are strategies like naming, this is a really important venue and opportunity for getting care on the agenda for governments in South Asia, where you make care visible in policy discussions. You frame it in terms of whether it's women's rights and well-being, or it's inequality, or even economic development. But I think the language of burden needs to be very carefully examined in terms of saying, well, is care a burden, or actually is care a good thing? And as I said, for us, it's been really about the fact that care is fundamentally a good thing. And then you can claim or demand government action in terms of public service delivery, and then programming, so not just for the state, but also for looking at designing programs that address unpaid care work. And popular communications are very effective strategies. I've put this viral email about migrant domestic workers up on the screen, but there's also 2 animations that you'll have the links to, that you could probably watch and see how popular communications are really effective in order to pinpoint what exactly needs to be done, and where the strategies can be more effective. In terms of policy asks, then, we are really at the stage where we're thinking about Diane Nelson's 2008 paper, where she talks about recognizing care work, reducing the drudgery and the difficult and inefficient tasks, and also reducing the time spent on unpaid care, and more importantly, redistributing responsibility more equitably, not just within families, but more specifically from families to states and employers. And then Oxfam put in the fourth R, which was a representation of carers in decision making, which all need to be done as a precondition for achieving women's empowerment and addressing poverty and inequality. But how does one do this in practice? So we did a study on childcare in the Asia and Pacific, and really specifically thought about how one can think about how childcare users and providers can be represented in decision making and design and policy implementation, and that really will lead to a recognition or rests also on a recognition of the centrality of childcare to women's empowerment and gender equality, and the recognition of childcare workers to not just society but the economy. We talked about reduction of time and energies associated with childcare, redistribution of care responsibilities from family to the childcare sector, through improved accessibility, availability, and quality of childcare services. But then we also thought about adding the fifth R, which the ILO has added, to kind of think about rewarding childcare workers through professionalization, training, etc., to attract and retain quality workers. But more specifically, how does one actually think about policies in our own countries, in South Asia, in terms of thinking about how care cannot be a burden? And in fact, we've written a paper on this, and so you can definitely find that. But thinking about the fact that if care is a foundational element, then we need to, of our society, then we need to really think about not just the quantity of care in terms of the recognition, reduction, and redistribution, which the Triple R framework does, but also towards increasing quality of care. And this makes the difference between thinking about gender blind, gender sensitive, and gender transformative outcomes, where gender blind outcomes are basically policies that don't address care, and gender sensitive ones are those that address care but not the differential needs of women, but because it kind of like almost essentializes the fact that care is a woman's responsibility. But if you think about a care transformative outcome, that can actually address the strategic needs of women and address both the needs of care providers as well as care recipients, and address the strategic needs of women. For this, we need what we call a 747 framing, where there are 7 foundational normative care principles, which go from kind of needing an explicit intention to care, and a care ethical perspective, to social provisioning by states, which we talked about a little bit earlier in terms of relational right to care, and states to step in very importantly as guaranteeing rights for all, including, of course, women. The third normative principle should be really about universal care entitlement. So policies should be available to everyone, irrespective of identity markers, but need to also then be specifically targeted to underserved and vulnerable groups, such as single mothers and indigenous groups. And this is where actually imputing a monetary value to care in terms of looking at what tasks take up the most time can really help in directing attention to those tasks and those policies. The fourth foundational principle is about affordability of care, that we need to, again, reiterating the role of the state and increasing uptake of care services, but with low out-of-pocket expenses, which is very, very important for most of our population, which is low income and, as I said, engaged in the informal sector. We need to increase the quality of care, which recognizes this person-dependent nature of care, and the fact that care is an effective labor-intensive and relational process, which then needs to be renegotiated between caregivers and care receivers. And that brings us to the sixth principle, which is talking about decent work for carers, which includes not only reducing drudgery, but also providing opportunities for unpaid and paid carers to be able to get what we call decent jobs, or rather, decent employment opportunities. And finally, this needs to be underpinned by an integrated and inclusive view of care, which considers the social locations and intersectional identities of caregivers and care receivers. The second element of our 747 is 4 care policy categories. So there's care infrastructure, which is things like piped water, hygienic sanitation facilities, but also clean sources of fuel and energy, to kind of think about, again, where women spend a lot of time in. Care-related social protection, which we've seen a lot in terms of cash transfers, non-contributory social insurance, but I think the fact of unconditional cash transfers really needs to be stressed here, because South Asia, alongside all other countries, especially Latin America and Sub-Saharan Africa, is kind of moving towards a conditional cash transfer model, which is actually detrimental to, again, women's time and energy. And we need to think about what the impact of these policies is going to be. So, if these are supposed to be care-sensitive policies, then they really need to be unconditional transfers. And there's also social welfare schemes like public works programs, subsidies and vouchers, school meals, etc. Care services are really important. These are not just childcare centers that are easily accessible and affordable, but also personal care arrangements for the elderly, institutional care of vulnerable groups like orphans, terminally sick, disabled people, etc. And the fourth category is about employment-related category care policies, which we can't forget, because there needs to be kind of things like care leave and not just maternity leave, but parental leave, which is shared and equitable, and offering creche facilities either near or on site as appropriate. So these are the care policy categories. But how is this going to happen? How are we going to suddenly move from what we have currently in South Asia to these 4 care policy categories, which are care sensitive and gender differentiated? Really will depend on levers of change. So there is a very important work to be done on legal and regulatory climate, on collecting care disaggregated data, not just sex disaggregated data, gender disaggregated data, where again, it's about, who does what, but also where and what tasks take up most time. Gender responsive budgeting is incredibly important. Advocacy for norm change, which happens both in intra-household as well as generally in terms of kind of like what societies accepts as responsibilities of men and women. And women's voices in decision making needs to be taken up, and all of this needs to be done through what we call a whole of government approach. So it can't be just done with one ministry, the Ministry of Women and Child or the Ministry of Finance. This is not like that. It has to be an integrated approach. Really, how one operationalizes the triple R is to think about, as I said, the normative care principles, which then if you have that as a foundation, you build pillars of these 4 care policy actions we've talked about, which can only happen if we have these levers of change in place, and therefore then policy outcomes can be care responsive and gender transformative. And I think that is something that we need to aim towards in South Asia. So in conclusion, really, a couple more minutes and then I'll be done. I've been speaking for a long time at you. I'm really sorry about that. But I suppose that's the nature of keynotes. So we've talked about how care work and unpaid care work specifically is critical to societal well-being, but it is unequally distributed. And we need to understand that not just economic, but also political and social empowerment of women and girls is not going to happen unless we consider unpaid care work as central and integral to our policy decisions. So we do need to recognize unpaid care as work, We need to reduce the drudgery associated with it and redistribute it from women to men and families to the state. But that all of this is not going to happen suddenly, right? Successive small wins and innovative strategies are very important. We talked about, for example, messaging through popular communications, etc. But what we do know is this keep calm and carry on situation is untenable. Women's labor cannot be treated as a free and finite resource. And really, if we talk about what Shara Razavi talked about as the care diamond, then it's not just families and households, but also states, markets, and communities that really need to take on care provision in society. And ultimately, it's really important to change our neoliberal extractive model that talks about the male breadwinner and the female caregiver to actually one shaped by principles of altruism and solidarity, where women's care responsibilities can be lessened. And that's me. I am sorry for running slightly over time. But I hope that you've enjoyed this, and I look forward to hearing your comments, and have a great conference. Thanks very much.